I'll be your nurse today. Can I get you to verify your name and date of birth for me?
Nick Ferris, 3892.
Okay, thank you. All right, so your doctor has ordered a pretty good bit of assessments today. We're going to do a cardiac and respiratory assessment. We're going to do a neuro assessment. We're going to check out your musculoskeletal system, and then we're also going to check out your head, ears, eyes, nose, throat. Okay?
Okay.
So to start off, I'm just going to do your respiratory. Here, listen for your respiratory sounds. All right, so I'm going to listen in a few different places. I just want you to take a deep breath for me, okay?
Okay.
Okay, so take a deep breath. Okay, so your right upper lobe. One more. Left upper lobe. Take another one for me. Left lower lobe. And another one. Right lower lobe. Okay, I'm also going to do the sides here for you. If you take a deep breath. So your right lower lobe. Another one. And your left lower lobe. Okay, so I'm going to move to your back. Okay, take a deep breath. And another one. Another one. And last one. Okay, so all those sound good. No adventition sounds or anything. So can I get you to do a good call for me? I just want to kind of check and see if we have any. Okay, so no mucus or sputum or anything like that. So one thing we want to do to help just kind of keep your airways open, so we want you to do a couple of deep breaths and coughs for us. So you take a deep breath in, hold it for as long as you can, blow it out. Then you also want to turn and give a good cough into your arm. Okay, great. So what that does is helps clear the airway, keep all the mucus and yucky stuff out of your lungs. You want to try to do that 10 times every hour. If you feel like that's not working and you still need some help, we can also speak to the doctor about getting you an incentive spirometer. So that's just a neat little device. We put a goal that we want you to reach on it. And as you take a deep breath like we showed, that you'll have like a bar that kind of rises to show you where you're at on your goal, and then you'll blow it out. So that'll also help open everything up. Do you feel like you're having any trouble breathing right now?
No.
Okay, good. All right, so what we're going to do now is move on to your cardiac assessment. So first thing I'm going to do is check for jugular vein distension. So if I can have you tilt your head back a little bit, turn to the side for me. Okay, and I'm going to check the other side. Turn this way. Okay, so that looks good. And I'm going to listen to your heart sounds. Okay. So right here, I'm listening for your aortic pulse, your pulmonic pulse, your Erb's point, your tricuspid valve, and we'll go over here and listen to your mitral valve. Okay, I'm going to do the same thing, but this time I'm going to listen for murmurs, okay?
Okay.
Okay, so that sounds really good. No abnormalities or anything that I heard. I'm also going to go ahead and just check your pulses and see, make sure they're strong or normal. Okay, so on that side you have a really good strong pulse. I probably rated about a 3. Same for this side. You also have a pulse right here, your brachial, and then you have an axillary right here, and then also your carotid right here. You have a femoral right here and a popliteal behind your leg, but we won't check those. I just want to make sure you know where you can find them if you ever feel like you need to.
Okay.
I'm going to check your capillary refill, so if you just hold your hands out for me. Okay, those all look really good. Okay, so they all refill within 2 to 3 seconds, which is normal. Can I get you to take your socks off? Because I'm going to check your feet for your pulses and your capillary refill and your toes, okay? All right. Okay. So I'm going to check the pulse in the top of your foot right here. I'd rate that pulse about a 2, so it's just normal. Also right here behind your ankle. I'd actually rate that about a 3. It's pretty strong. right there is also probably a 2. And the same for that one, probably a 3. They're pretty strong right there. All right, I'm gonna push on your toes and just check your refill in your toenails. Okay, so those all look really good. Okay. Oh. So we're gonna move on to the remainder of our assessment that we have to do a little bit. Okay. So for the first one, we're gonna check your head, ears, eyes, nose, and throat. So just looking at your head, it looks pretty normal in shape. I don't see any deformities, no, everything looks pretty symmetrical. Let's see. So at this point, I'm gonna put my gloves on, wash my hands, and I'm actually gonna just kind of palpate your skull and check for anything, okay? Okay, so everything feels really normal, nothing alarming, nothing, again, no enlargements, no dentations, nothing like that. Let's see. Have you had any kind of recent head trauma, any headaches, anything like that?
No.
Okay. Next, I'm gonna look at your ears. So they both look average in size. They again look symmetrical. Let's see. So, and I know that because the outer corner of your eyes align with the top of your ears on both sides. Do you feel like you're having any trouble hearing? Have you had any recent hearing loss or any problems like that?
No.
No? Okay. All right. Now I'm gonna look at your eyes. So the first thing I notice is your iris. Your eye color is blue. Very nice. I notice that your pupils are equal in size and round. And your scleris is also white, which is normal. We wouldn't want it to be anything like pink or red because that could indicate some kind of conjunctivitis like pink eye or something like that. So let's see. Do you wear any like contacts or glasses normally?
No.
No? Okay. So what I'm gonna perform now is a Perla test. So it's gonna check for your pupils, or if they stay equal, round, if they react to light, and if they accommodate. Okay? So what I'm gonna have you do is, I'm gonna measure your pupil size before I use the light. So I have a measurement on here, so I'm gonna just kind of place it under your eye just to see where it's at, okay? Okay, so they are measuring about a 4, which is good. That's within the normal range. So this time I'm gonna shine a light in one of your eyes. I don't want you to look at it with both. Actually, you can just look straight and I'll shine the light to see how it reacts to my light, okay? So if you just look straight for me. Okay. I'm gonna move to the other one. All right, good. So they both reacted normally to light. They constricted like they should. So this one actually constricted 100% when I shined the light on it, and this one constricted 50% while the light was in this eye, and then vice versa. Which is normal. That's what they're supposed to do. And also I want to test your pupils. So I want you to look at this light and then follow it as I bring it closer to your face to see how they accommodate, okay?
Okay.
All right, so I did notice that your pupils restricted as I brought them in, and then they went back normal as I brought the object further away, which is what they're supposed to do. So that's all within normal range. Now I'm gonna move to your nose. Which does look normal in size. It looks symmetric, anything like that. Have you had any kind of issues as far as breathing or sinus problems?
No.
No, okay. So what I want you to do is I'm gonna do a nasal patency test. So I need you to close one nostril and then breathe in, and then do the same. So close the other nostril and breathe in. Okay, now swap on the other side. Any troubles with that? Did one of them feel stopped up or anything? Which one?
This one.
So your right one seemed stopped up as you breathed in through your left side, or when you pushed your left side, the right one, you had like trouble breathing out of your right?
When I pushed the right side. I mean, when I pushed the left side.
You had trouble breathing out the right side. Okay, so we'll let the doctor know that. It could just be sinuses with all the hot, cold weather going on, but we'll let them know that. So now I'm gonna check your mouth, which first glance, your lips look moist, normal in color. I don't notice, any crackling or anything like that. So if you could open your mouth, I'm gonna look at your oral mucosa, I think. Okay, so I. All right, so again, everything looks normal, nice and pink. Say cheese. Your teeth look white. I didn't notice any kind of decay or breaking when I looked inside of it, so that's all good. All right. So just looking at your neck, I don't see any kind of abnormalities, no distension of anything. Like, you know, we already checked your JVD right there. Can you sit up straight for me? Okay. So your shoulders appear to be normal. They don't seem, you know, no lopsidedness or anything like that. No masses, anything like that. Let's see. Do you feel like you have any kind of like range of motion issues with your neck? Like you can't turn it or move it or bend it?
No.
No? Okay. And your shoulders don't cause you any problems to do like that?
No.
Okay. All right. Everything looks aligned, which is great. So I'm going to give you some water to swallow, and I'm just going to grab right here. I'm not going to grab. I'm just going to hold right here and just check your trachea as you swallow to make sure that there's no problems with that, okay? So here's your water. Okay, so just swallow that for me. Okay, so everything felt really normal. Didn't feel any issues with swallowing. Have you had any kind of issues swallowing recently?
No.
No? Okay. All right, so I do gotta ask you just a few questions to go along with your neurological exam. Do you know where you are?
Yes.
Okay. Do you know why you're here?
Yes.
Okay. Do you know who the current president is?
Yes.
Okay. So that just lets me know that you're awake, alert, and oriented. Let's see. And that also goes hand in hand with the Glasgow Coma Scale. We use that to test your consciousness. So there's 3 categories for it. Your eye response, which we've already checked that, your motor response, and your verbal response, which so far you've done great. Everything indicates that you're neurologically fine and conscious. Let's see. So I'm going to move on to your musculoskeletal assessment. Now, are you having any issues with any joint pains or anything like that? Any movements?
No.
Stiffness?
No.
Okay, great. So the first one I'm going to check is your elbow. So I'm going to hold right here, and if you just flex up and down for me. Okay, so no pain while doing that?
No.
Okay, so now I'm going to check your resistance, I believe. So try to push up against my hand. Okay, and I'm going to do now push against my hand again. All right, I'm going to swap over and do this side. So again, just normal flex for me. Okay, now push up. Okay, push down. All right, now this time I'm going to do your wrist. So if I can get you to take your watch off for me. Okay, so if you just move it, I'm going to turn it this way. So if you'll move it all the way up, out, straighten your hand for me. So up, out, and down. Okay, now did you feel any kind of discomfort while doing that?
No.
Notice a little bit of popping. Is that normal?
Yeah.
Okay, does that happen like a lot of times when you move
Yeah.
your wrist? Okay, but no pain while doing that?
Nope.
Okay, so push against my hand. Okay, and push on my hand. All right, do the same with this one. So we're gonna go hyperextend, extend, flex. Okay, so push against my hand, and again. All right, good deal. So now I'm gonna move down to your lower extremities. So what I'm gonna check is your knee joint and your ankle. So if you give yourself a little bit of room, because I need to see you kind of bring that leg back. So we're gonna extend and then flex, so bring it in. Okay, now I'm gonna hold your calf right here. You can relax it. All right, so I want you to try to push against my hand. Okay, now do the same. All right, now I want you to do the same with that one. So again, we're gonna extend and then flex. Okay, and then if you'll push against my hand, and now push against the other one. Okay, good deal. Now, did you have any pain while doing that? Okay, no popping or anything. All right. So we're gonna do the same with your feet. I'm actually gonna hold your ankle right here. So I need you to have your foot and go up, and then also I want you to go and point it down for me. Okay, so point it up, okay, and then point it down. Okay, now push against my hand and push on my hand. Okay, and let's check this one. Okay, so bend it up and down. Okay, push against and push down. Okay, so everything felt fine?
Mm-hmm.
Is the popping that we heard normal?
Yeah.
Okay, that happens pretty regularly. Do you have any pain while that happens?
No.
Okay, good. Okay, so this time I'm gonna have to evaluate your gait, which is just the way you walk, and then also your balance. So if I can get you to stand up for me. Okay, so I just want you to walk normal, just walk straight ahead. Okay, you can come back. So there was no swaying. You seem very balanced, very smooth. Now I need you to do Tatum walking. So what we're gonna do is you're gonna go heel, toe, and that just checks your balance. Okay, now you can come back. I have one more test for you. All right, so we're gonna do the rompers test. So I want you to stand facing me, close your eyes. I'm gonna hold right here just in case you start to fall. And we just wanna check for any kind of swaying, okay? All right, and generally we would do this for 20 seconds to get an accurate read, but we'll go ahead and let you be done because your walking showed that you were pretty normal. And you said that here recently you haven't had any pain or discomfort or anything anywhere in any of your appendages or anything like that, right?
No.
Okay. All right, good deal. Well, I will let the doctor know, and they'll be in shortly with you, okay?
All right.